Well, the situation is really difficult. 2 years after the beginning, you can see that the situation has massively deteriorated. The population faces incredible problems in the field of health, but also infrastructures have been destroyed. You have some fuel shortages, and in a city like Sanaa, the fuel is also there to produce water, electricity. So the everyday life of the civilian population has become extremely difficult, and we are really quite concerned about that situation. In a country like Yemen, having access to where the assistance is really needed is an everyday challenge. It's really quite difficult. I have to say that I'm very impressed by what the teams of the delegation, ICRC delegation, are doing, reaching the front lines, for instance. But it's not only the question of going to the field and reaching the places of the people. You also need to have the supplies reach Sanaa, and already this is a challenge in itself, because now we have a problem of importing the goods because the harbors are not accessible as before. So this as well is quite a challenge. Now we are again trying to reach out to the populations wherever they are. Sometimes they're quite difficult to reach because some cities like Taiz, for instance, have front lines around them, and crossing a front line is never something which is easy to do. It can be dangerous. But even getting the goods in our warehouse from outside the country is also a challenge when you consider that the main harbors, Aden and Odeida, are not as accessible as they were before. The civilians are always those who suffer the most in an armed conflict, and we respond to their needs both in general terms. For instance, water. All the civilians need water, so we have provided water. We have put a priority, in fact, on providing water in the main urban centers, because if water is discontinued, then you can have a catastrophe in terms of public health. You also have civilians who are in particular difficult situations, such as civilians who are in a city which is surrounded, like Taiz, and we deliver bread to bakeries so that they can receive bread free of charge. We have also helped handicapped people who can go into the centers and get prostheses whenever they have lost a limb in whichever way. And we have also provided insulin, which will be greatly needed for people who have a diabetes problem. There is also categories such as detainees. We visit detainees who, of course, in a situation of conflict are in a more difficult situation than in normal times. So I would say that these are the main needs that we have answered in the past 2 years. We, of course, react to the humanitarian needs which are out there by helping civilians and so on, but we can only do so much, and at the end of the day, it is also the responsibility of the parties to the conflict, whose population it is, to care for their population and to ensure in doing so, by respecting the rules, international law that govern armed conflict. By respecting these rules, civilians are better protected, and therefore are in a better situation to face the difficult future that is ahead. And hopefully the situation altogether will improve. That's the hope we can certainly form for Yemen.